It's where it's using electronic impulses to test your brain or your heart. Now you have a EEG and an EKG, and I always get them mixed up, but I'm pretty sure that EKG is how they test your heart and things like that, whereas the EEG, it's where they test your head for certain patterns, and it will usually do a certain pattern on the paper with the pins and all that. Endo, within. You'll probably go into a hospital at some point and see the word endoscopy, and that just means it's a department where they do an examination with some kind of scope that goes inside part of you. For example, a gastroscope. So here we get to combine two root words actually. So we have the root word gast or gastro, and then the root word scope. So that just, in other words, means it's a scope that will go inside you and check inside your stomach and your digestive system, but is still considered an endoscope. Okay. Epi, as in like epigastric region. It's just referring to the top part of your digestive system. Hyper, above normal. Hypo, below normal. Macro, large. Micro, small. So like a microscope would be something to see something small, whereas a macroscope would be to see something large. Peri, around. Sub, under, below. So like subarctic, for example, would be below Arctic. Tachy would be fast. Okay. Alright, so now we have some common suffixes that you'll see at some point. Al or ick is related to. Algia is pain. Site is cell. Ectomy, surgical removal of. Gram, the actual record. A graphy, the process of recording. Ist, one who specialize. Itis, inflammation of. Magelli, enlargement of. Ologist, one who studies in. Ology, the study of. Oma, a tumor. Otomy, cutting into. Ostomy, surgically forming an opening. Pathy, disease. Penia, decrease or lack of. Phobia, fear, like arachnophobia is the fear of spiders. Plasty, it's like I just mentioned previously, rhinoplasty. Scope is a viewing or an examination instrument. So I apologize when I was talking about gastroscope. That's actually combining a root word and a suffix to look inside your stomach. Okay, so now that we've discussed that, now let's kind of talk about how they're put into play a lot. So here's some ones that you've either heard of or will probably see at some point on the news or in a hospital. Mammography, the recording of an activity in the female breast, usually to check for breast cancer. Now it's different than a mammogram. The mammogram is what you get as a result of mammography. So mammography is when they're recording it, and mammogram is the actual record once that's complete. Alright, gastritis, inflammation of the stomach. Arthritis, inflammation of the joints. I'm sure you've heard of arthritis. Neurologist, one who studies nerves. Usually it's in context to the brain. As I said before, the brain's part of the nervous system. Rhinoplasty, again, surgical repair of the nose. Melanoma, skin tumor, or cancer. And now when we're talking about tumors, usually a tumor means that it's cancerous. And so when I say a tumor, it's usually that form of cancer. Not necessarily always. I mean, say like you have brain tumors, but just because you have a brain tumor doesn't necessarily mean that you have brain cancer. So that term kind of goes both ways. Endoscope, as I just mentioned, the scope to view your insides. Hyperglycemic would be the opposite of hypoglycemic, which would be high sugar levels instead of low sugar levels. And it's usually when we're talking about blood with like diabetics and stuff like that. So a diabetic doesn't ever want to be either hyper or hypoglycemic. Okay. I'm sure you've probably heard of hypothermia before. It's a below the normal temperature, and usually when we're talking about hypothermia, we're talking about a seriously below temperature because your internal body temperature, of course, is 98.6. And the temperature of your body, let's say, is 75, 80 degrees. Now that, inside of a room, that's a pretty good comfy temperature, but inside your body, if it starts going below that, you're pretty much dead, so it's never a good thing. And as I put there, there are many others you'll see or hear eventually. Just remember to put them all together. And it usually makes sense. Now, there's a lot of root words and things that I didn't really cover on because, again, I don't want to make this like a big medical terminology class for you. I don't want to bore you. I'd say that's probably the most common ones that you'll see. But if you want to look into like specific things, and if you heard a particular thing from a doctor that maybe you didn't see here, I would say just Google it, or even if you want, send me an email. I'm gonna put my email on the end of the video here. It's just gettingfitnaturally@gmail.com. I was thinking of making one that's from my gettingfitnaturally.com domain, but we'll see how that goes. Alright? So yeah, if you have any questions, feel free to send me an email or put a comment below or message me through YouTube, and I'll be happy to answer any questions you may have. I just hope this has been informational to you, and hope we could clear some things up in this. Alright? Well, I am out for now. I'll hope to see you next time.